Okay, good afternoon, everyone. Hopefully others will be able to join us in a few moments, but just in the interest of everybody's time, we may as well get started. So my name is Dervla Morris. I'm Principal Investigator on the PIER project, and I'm delighted to welcome you to this event this afternoon to meet the project team. We're core members of the project team. If you have any questions at any stage for any of the presenters, just pop your question into the chat and maybe just indicate which speaker you'd like to direct your question to, or if it's an open question, that's good too. This event is being recorded just for everybody's information. And if possible, could you keep your microphones muted, just to prevent any background noise throughout the presentations. Great, so without any further ado, we'll start, and thanks again for taking the time to join us today. So I'm going to quickly run through a background to why we're doing the PIER project. You'll then meet Sinead and Dimitri, who'll talk to you about the Blue Spaces study. Maeve will speak to you about the colonisation study, and then Alex will take you through an update on the persistence study. And Liam will round things off with an update on what we're going to do next. And as I said, if you have any questions at any stage throughout the presentations, just pop them in the chat and we'll have an opportunity to discuss them at the end. So in terms of why we're doing the PIER project, as many of you here may know, antibiotic resistance is recognised as one of the greatest threats to public health that we're now experiencing. It's very often actually referred to as the silent pandemic. And following on from a review completed or commissioned by the UK government, they have estimated that by 2050, 10 million deaths per year will be attributable to antibiotic resistance unless we take action now. And I've been working in this area for over 20 years, and it's great to see governments around the world finally recognising the significant challenge that antimicrobial resistance is. It reached the floor of the UN General Assembly in September of 2016, only the fourth time in history that a human health issue has been brought to that forum. So this led to the publication and development of a global action plan on antimicrobial resistance, which was published by the World Health Organization and other groups in 2015. And that then led to several states across the globe adopting the Global Action Plan on Antimicrobial Resistance and developing their own action plans, including the European Union's One Health Action Plan against antimicrobial resistance, and indeed Ireland's own National Action Plan on Antimicrobial Resistance, which was first published in 2017. Next slide, Liam. And the second revision of our National Action Plan was published in November of last year. All of these action plans take a One Health approach. So the One Health concept recognises that the health of humans, the health of animals, and the health of our shared environment are interlinked. So it's not possible to tackle a challenge such as antimicrobial resistance without taking One Health approach. Next slide. But it's been recognised in many of the revisions of the original national and global action plans that the environment is the one part of the One Health paradigm that hasn't received as much attention as the human health and animal health sectors to date. And what we're working on in the PIER project is try to bridge that knowledge gap to understand better what role the environment is playing in the transmission and persistence of antimicrobial resistance. Next slide. So through the PIER project, which as many of you may know, started first in March of 2019 and is funded by the Environmental Protection Agency. Through this project, what we're hoping to do is to understand better what the consequences are for people who use recreational waters a lot. And if they're exposed to antimicrobial resistance in those recreational waters, what's the consequences for them? So to do this, there's two essential parts to the PIER project, and you'll hear a lot more about this over these brief presentations this afternoon. We'll first do a colonisation study, which we've completed, and Maeve will update you on that. And within that, what we are looking at is whether or not people who use recreational waters a lot are more likely to be colonised with antimicrobial resistant organisms than those that don't use the water a lot. And thanks to those of you that have joined us, that have taken part in both the point prevalence study and in the persistence study that Alex will talk to you about. The second part of the study then is a systems mapping approach, which Sinead and Dimitri are going to speak to you about. And in this part, we're hoping to understand better why people engage with our blue spaces and what stops them from engaging with our blue spaces. And overall, what we're hoping to do in the PIER project is to inform policy, essentially, to help to try to make our blue spaces and our recreational waters better for all. So now I'm going to pass you over to Dimitri and Sinead, who are going to talk to you about the Blue Spaces study, and we will all be able to have a nice chat at the end of the presentations. Thanks.
Hi everybody, my name is Dr. Sinead Duane and I'm a lecturer in marketing here in the University of Galway, and I'm also a researcher on the PIER project. My colleague Dimitri Vrishkov is also here, and he is the postdoctoral researcher on the project. Today I'm going to introduce you a little bit about the aims of the Blue Spaces study, and Dimitri is going to take you through what we find. So next slide please, Liam. So as Dervla said, our waters or our blue spaces here in Ireland are really important to us. There is a defined link between our health and well-being and the health and well-being of our environments. And through a One Health approach, we became very aware that in order for us to help improve the quality and maintain the quality of our blue spaces over time so that we can all enjoy them, that we need to look at the issue of blue spaces more holistically. So try and understand why and how people are using it and what might be stopping them. So the aim of the Blue Spaces mapping exercise is to try and identify what are the barriers for using our quality blue spaces, so the things that are stopping us, and what are enabling us. So what are the things that are working well. So traditionally, when we looked at problems such as blue spaces, there was a traditional thinking whereby if we looked and we defined the problem, i.e. blue space quality, and we told people what was happening and the issues that were arising, that people would improve their behavior or change their behavior for the better. Now, as we are moving into an era whereby our problems are becoming more and more complex. So if you think about the issue, as Dervla described it, of antimicrobial resistance and the connection between our human health, our animal health, and our environment health, we now realize that problems aren't linear. So us telling you about the problem and providing solutions doesn't have the impact that you would expect. So there's a new approach called systems thinking that looks at a problem more holistically, where we now think it's really important to look at how problems or how different factors or different barriers within a problem are related, are interrelated, and what are the impacts of changing behaviors or design an intervention in one component of a system, what implications that have for another component. So in the Blue Space surveys, we are really focusing on trying to map what the issues are in blue spaces in Ireland, and then we hope that this will inform policy in the future. So what did we do? If you can go to the next slide, Liam. So after across the last 2.5 years, 3 years, we have adopted a methodology called systems dynamic modeling, which helps us understand this and build a map of these interconnections between our barriers and enablers to using blue spaces. So thank you to all of you that participated in this research, because it's really important that from a One Health perspective, it's not us telling you how to improve our blue spaces. It's about taking the voices of the collective and co-creating change strategies for the future that are embedded within society. So we started off with conducting in-depth interviews and mini workshops with what we called stakeholders in the issue. So we looked at people like policymakers and community groups and individuals who use our blue spaces, so our rivers, lakes and seas. And we talked to them about how they use them, why they use them, and what's stopping you from using them, but also what's working well. So what do we like about our blue spaces, but then what things can we improve? We did 19 focus groups, 19 in-depth interviews, and then we said we would open this up so that every citizen on Ireland, on the Republic of Ireland, would have an opportunity to speak to us about our barriers and our enablers to using blue spaces. So 1,000 people took part in the survey back in 2021. And as a result of that, we spent some time analysing the data, grouping together the big themes or the major themes. And then we brought it to our Blue Space workshop that took place in May. So at the Blue Space workshop, we invited stakeholders, again, from different backgrounds and different perspectives, to try and map the interrelationships between the different barriers and enablers to develop our systems map collectively. We then shared the map with stakeholders to ensure that it reflected the views of many different types of stakeholders, and again, not necessarily the views of us as researchers, but that we developed a map that has been co-created by the people that actually use our Blue Spaces. I'm going to now hand you over to Dimitri, who's going to talk to you a little bit about what we found.
Hello, my name is Dmitry. Hello, everyone. And I would like to speak a little bit about our results. And first of all, I would like to speak about the group model building workshop that we had. It's actually very simple. So at the start, you have your problem in mind, which is, in our case, was the problems with Blue Space usage and their protection. And then you gather different people with knowledge of this problem. You gather, as Sinead mentioned, from different layers of society, from different fields. These are users, these are policymakers, NGOs, businesses, academia, etc. And these people, they collectively draw a map of our problem. And this map consists of different factors, and these factors are actually causes and effects. And very often these causes and effects, they come as what they call feedback loops, because effects sometimes influence the causes. So you probably could name lots of examples when our policy backfire on us, and we have different issues because of this. And I would like to share our result, our map, which is on the next slide, please. So that's what we got. It's our map, Blue Space Usage and Protection Map, in a sort of a simplified manner. At the very center, we have our key variables, our key issues, and we definitely know that Blue Space are quite attractive and appeal to their usage. And for this, we need increased access, and which requires increased protection. This is a clear indication of this feedback loop, but this loop is affected by a range of other factors and other loops. For example, for good protection of Blue Spaces, we need adequate policy and good adequate information. And for this, we need adequacy in consultation when different stakeholders will be actively participating in solving this problem. We need to address the causes of the issues, not their effects. We know that Blue Spaces provide lots of social benefits, and they help to build communities. For this, we require Blue Space culture, which should increase building this, improve building these communities, and improve teaching and learning about our Blue Spaces and how to use them. Of course, Blue Spaces, we talk about the responsible usage of Blue Spaces, and we need some visitors. But when the critical mass of the usage of Blue Spaces is exceeded, we have issues instead of benefits. Another big topic is the willingness to travel to Blue Spaces, because it depends from the availability of transport infrastructure. We also know that Blue Spaces provide lots of physical and mental health benefits. Use costs could be both enabler and a barrier. When we're talking about such Blue Space activities as walking, it definitely is a big enabler when we're talking about more expensive types of activities like yachting and kayaking, etc. So this may be barrier. Antisocial behavior was marked as a very strong barrier, and it was backed by the excessive use of alcohol. Pro-business focus of Blue Space usage could work both ways. It could be both enabler and a barrier. The same refers to the laws, insurance, and ownership. And these are, in brief, the outcomes of our results, and we have lots of other information regarding this map in the form of loop stories, loop narratives, and in the different elements of this map. Okay, thank you.
Hi everyone, my name is Louise Farrell and I'm the PhD candidate on the PIER project. So I'm going to be talking today about the colonisation study, specifically the point prevalence study. Next slide, please. Thanks. So as you guys know, we had a national distribution of participants, and these were broken down into two sampling regimes. So I'm going to be talking about the point prevalence study, which we sampled 428 of you from September 2020 to October 2021. And Alex is going to be talking further about the persistence study, which included about 50 people over the course of the year. And we really appreciate everyone participating and engaging with us throughout both of these studies. So we just wanted to say thanks especially for that. And just to note that we're looking for two specific types of antimicrobial resistance, which have quite long names. So we have extended spectrum beta-lactamase producing Enterobacteriaceae, which I'm going to call ESBLs for ease. And then we have our carbapenemase producing Enterobacteriaceae, which is our CPEs. Next slide, please. So our registration of interest just involved nearly 2,000 of you trying to sign up via our Qualtrics surveys. And in total, we included 212 non-water users, so those of you who didn't use recreational waters like our rivers, lakes and seas, and nearly 200 water users. Following on from that, you guys submitted a fecal sample and a completed survey for us to input into our data cells. We then streaked our fecal samples directly onto two selective agars. So what these agars are is essentially a jelly filled with nutrients. And these nutrients also have an antibiotic applied to them, which means that only certain bacteria can grow, such as our ESBLs and our CPEs. So our ESBLs would be ones that are resistant to last resort or third generation cephalosporins, which are like type of last resort antimicrobial. And then CPEs will be resistant to our carbapenems, which are definitely antibiotics we save until the very last moment. And then we did identification of the bugs or the little organisms that grew on these jelly agars and via MALDI-TOF. That's just a laser that identifies them for us. And following on from that, we did antimicrobial susceptibility testing. And this is basically where we place a little disc with a certain amount of antibiotic in it onto another agar and lawn out our bacteria. And we can just see, according to this, how resistant or how susceptible, as you can see, Liam is circling it for me, thank you. These zones allow us to see how well the antibiotic works on the bug, essentially. Following on from that, we did some genotypic testing. So essentially we did some PCR, which is our polymerase chain reactions, and basically looked to see what genes these bacteria had. And now most recently we're doing what's known as whole genome sequencing, which Liam's going to talk about a bit more later. And this is where we're looking really in depth to see what types of genes these bacteria have, but also what other stuff they have that could make them more resistant to antibiotics or anything like that. Next slide, please, Liam. So just to give you a quick breakdown, so we had our water users and non-water users, and the majority of people who returned packs were female, so about 60% in both groups. They were all very highly educated, so about 40% of you had a postgraduate degree, so a master's or higher. And about just under 20% in both groups worked in animal or healthcare sectors, so either worked as a nurse or a vet in the animal sectors. And just to give you a quick breakdown then of the results, so 411 participants were included overall, whereby they sent a suitable sample, so a sufficient amount of sample to us, and they completed all survey questions. Following on from that, we discovered that 29 had an ESBL in their fecal sample, and 9 had what's known as a CRE, so carbapenem resistant isolate in their fecal sample. So this is just where you've carried the bug for a certain amount of time in your gut and it passes out through your feces and is completely asymptomatic and doesn't cause any issues. So just to give you a breakdown then, the blue here refers to our water users. So 7 water users were carrying an ESBL isolate, and 22 non-water users were carrying an ESBL isolate. Following on from that then with our carbapenem resistant isolates, there was 4 isolates recovered from a water user and 5 from a non-water user. And these are referring to isolates that were detected directly from our jellies, so our agars, but we are hoping to do further testing, which Liam is going to describe later, which will allow us to see if potentially there was more isolates that we just didn't pick up in our initial sampling period. And that'll be known as the metagenomic study. But Liam will talk to you a bit more about that later. Thank you.
Hi, everyone. My name is Alex Shueri. I'm a research assistant on the PIER project. I was in charge of the persistence study. So as Maeve had mentioned earlier in her slides, that the persistence study was a longitudinal study where we followed 50 participants over a year for colonization rates. Next slide, Liam. Thank you. So I'll just give you an overview of the persistence study, which began in October 2021. We had sample packs sent out every other month over the course of a year, with our first round of sample packs being sent out in November of 2021. Our last round of sampling just concluded a couple of months ago in October of 2022. As I said, we had 50 volunteer participants. One was eventually excluded due to inactivity. So in total, we had 49 that we sent packs out to over the course of a year. For our persistence study, we did a technical evaluation. So these were the methods that we processed and in what method that we would choose to go through with our persistence study. So we evaluated 3 methods on chromogenic agar, as Maeve already brilliantly pointed out about our chromogenic agar. We first did our feces directly streaked onto our agar. Now this is the method that was also used in the point prevalence study. So this was kind of just a comparison to see if there were other methods that were better. So after our feces was directly streaked, we then did a broth culture and supplemented with antibiotics. We did 2 different participants, and we had a sample of 20 microliters and 100 microliters just to see which one was best. And we supplemented the broth with 1 milligram per liter of cefotaxime. We then did a saline feces mixture, the same protocol as a broth culture supplemented with antibiotics. So we had 2 participants and we used 20 microliters and 100 microliters of each. Our method that we ended up working with was our feces directly streaked. We thought it was the best method to go with, which made it easy for us because that's what we had been doing for the past 2 years. So no change necessary. And it was a validation that we've been doing a correct thing for the past 3 years. So after we developed this method, we then decided that we would take 3 colonies of each different morphology or color and pick them off using sterile toothpicks to be cultured on separate agar plates for identification. So this was just to make sure that we were picking up the same colonies, even though they might look similar. Some bacteria tend to grow similarly to others. So we just wanted to make sure that we were picking up the same thing and doing it in triplicate as good scientists do. Next slide, please. So as many of you may know, for the persistence study or our point prevalence study, our packs were the same. So our sample packs contained sorry, Liam, can you just scroll through them? Thank you. A consent form, and you can see the arrows just pop up as well. A questionnaire, a privacy envelope, sample collection instructions, sample pots and containers, return mailer, and sorry, and these were sent out, as I said, every other month over the course of a year. Now, the important bit is what we want to thank all of you for was a successful recruitment. Over the course of 12 months, our average return rate was around 90%, which is way more than we ever expected. And that's thanks to our participants that were in communication with us and sent back their packs so regularly, and it really helped us in our study. And we just wanted to thank you all. A 90% return rate over the course of a year may sound insignificant a little bit, but in similar studies, a return rate of 90% is incredible. You know, the retention span that our participants gave to us was nothing like we ever imagined. So a massive thank you to all our participants that participated in the persistence study. Now I'm going to pass it away to Liam, who's going to talk about next steps in the project.
Hi everyone, so hopefully you're all still with us, and thanks so much for taking the time today to join us to hear updates on the project. So as you can see, we've been very busy over the last year or so, so I'm just going to talk about what's left for us to do now in the final year of the PIER study. So what Maeve and Alex have just presented there is the results of our colonization studies. And so far, we've done a lot of analysis on the bacteria that grew from your samples. However, we haven't so far had time to do full whole genome sequencing analysis. So just to kind of introduce, I suppose, what that actually is and what it can tell us. So whole genome sequencing is when we sequence the genome or the complete set of genes that are present in an organism, and using a laboratory method to determine what the entire sequence of the DNA in that organism is. So it's great for us because it allows us to compare organisms that we collect in different times and places, and also to kind of hypothesize how they may have spread and evolved over time. So it's something that clinical microbiology laboratories all over the world would do now to kind of compare the different types of bacteria that people present with, whether it's bacteria that are causing infections or just like the PIER participants, bacteria that they are colonized with. So whole genome sequencing has been done on lots of the superbugs that we found from the PIER samples, and we're in the process at the moment of analyzing all of this sequence information. So what we're hoping that it'll tell us is whether the superbugs that healthy people are carrying are similar to the ones that we see patients carrying that cause infections in hospital. It might also tell us whether superbugs that swimmers are carrying are the same ones that we have found previously in waters. So that would be very interesting because it would allow us to show a direct link, I suppose, between the water, the bugs that are in the water and the people that are using the waters. So it'll also allow us to see how antimicrobial resistance genes are actually shared between bacteria in the gut. So we can, in using metagenomic sequencing, which I'll talk about next, we can compare the different bacteria that are present in the one sample and see whether they have the same genes or whether they're sharing genes between each other. We also can, as well as looking at antimicrobial resistance genes, we can look at all of the other genes that the bacteria have, and we can categorize them into genes that are able to assist them in causing infections, or if they carry those genes, then they have the potential to cause infection. Whereas if they don't carry those genes, maybe they're not really as much of a threat, and they're more kind of associated with environmental bacteria. So once we've done the whole genome sequencing analysis, the next step is metagenomics. And this is even more complicated, I suppose, in that instead of sequencing the genome of one bacteria that we have isolated from a sample, here we're looking to sequence the genomes of all of the bacteria that are present within a sample. So a sample can be anything really. It can be an environmental sample, like a water sample, a clinical sample, like a blood sample or a urine sample, or it can be a fecal sample. So why we would do this really is because in the methods that we use so far in the PIER study, culture methods, where we grow bacteria from the feces. However, it's only about 2% of bacteria that we can actually grow using these methods. So the other 98%, we actually don't really know what's there. So metagenomics actually allows us to see a lot of the diversity that was previously hidden then in those fecal samples. So we can get an idea of, what kind of constituents people have in their gut, and whether swimmers have a different type of communities of bacteria in their gut versus people who don't regularly swim. So as well as telling us how long people carry these superbugs, so like Alex mentioned there, we're using culture-based methods to try and determine whether people are carrying a sample from, a superbug in their feces from month to month. But sometimes we can't always grow the superbugs, even though they might be present. Metagenomics will allow us to see if the genes are present, whether we can grow them in the lab or not. It'll also allow us to see what other bacteria are present. And like I said, whether people who are using the water a lot have a different microbiome or a different population of bacteria within their gut than people who don't. So this might explain why we found less superbugs in water users than in people who don't frequently swim. So, you know, these results are going to be very interesting for us. So that's most of the analysis will be done over the next few months. So we're hoping that we'll be able to complete the persistence study data collection and analysis between January and around about April. And then from then on, really, it'll be just about writing up all of our results and presenting them at scientific conferences. So we've already presented at a couple of scientific conferences already, and we've published 1 or 2 papers. We're hoping to publish all of this research over the next few months. And as well as that, the funders also require us to publish a final project report. So that'll be towards the end of the project in September. And then I think most importantly is we want to hold a final stakeholder workshop with policymakers and other people who can use these results that we've worked so hard to generate, and you guys have helped us to generate, to make a difference. So whether it's improving how we deal with our wastes, or whether it's making blue spaces more accessible for those who want to use them, this final stakeholder workshop will go a long way towards getting that information and that knowledge into the hands of the people who can actually use it to change the situation. So with that, there's nothing left to say really to you guys, except thank you very much for all your help with the PIER project and for your participation in our different studies. Thanks to the other project team members from our partner universities, University of Exeter, Queen's University Belfast, and of course the Health Service Executive. Our public health experts from the Health Service Executive were really critical in the study as well, in the design of the study and also in carrying out the Blue Spaces survey and participating in workshops. So all of our social medias are there if you want to keep up with any project news that's going on over the next year. We'll be posting any big news on our social media. You can check out our website as well, where we'll be posting any journal papers once we have them accepted for publication. And that's about it really. So I'll just finish with the questions and answers session now. So if you haven't already done so, and if you have any questions for the team, please pop them in the chat and we can answer them for you. Thanks very much. So I can see that there has been one question so far put in the chat, and I think it was directed to the Blue Spaces team. So Dimitri, a question came in. Lots of the slides presented by Dimitri could apply to the use of e-bikes and e-scooters on footpaths, a current debate. Would you care to comment on that?
Yeah, sure. Yeah, definitely, especially the factors which are related to the adequacy of consultation, which is a big barrier, for example, in Galway transportation and Galway active mobility system. We have big issues with the inadequacy of consultation and inappropriate policy at the moment, and it's one of the big barriers. Another issue is, of course, if we're talking about the active mobility, the use of e-scooters and bikes, it's the lots of vested interest in the system when the interests of different stakeholders collide and cause lots of problems, and the problems are not solved in an appropriate manner. and car-centered mentality. And such kind of issues we see in Blue Spaces as well, when we have people with different genders and different interests, and things are not improving, and we're only at the stage of constructing or building our policy at the moment for the usage of Blue Spaces, and it's a big barriers, a lack of such policy as well. And we also encounter with lots of inappropriate behavior, like from the antisocial behavior and mentality issues that's also affects both the usage of Blue Spaces and the active mobility sector. I fully agree that this our outcomes, they come across all systems related to both types of activities, the Blue Space usage and active mobility. Yeah.
That's great. Thanks very much, Dimitri. Does that answer your question, John? Yeah, happy enough with that. Okay. So we don't have any other questions in the chat at the moment. So Steve has put in a comment to say thanks everyone for all your time and your efforts, and thanks to you, Steve, for your efforts and for all of your efforts in helping us with this study. Any other questions, folks? Great, we must have done a great presentation, completely clear.
That's great. I'd just like to add again, thanks everybody for taking the time this lunchtime to join us. And if you do think of any questions or of anything you'd like to follow up on, don't hesitate to contact us. I think as Liam had showed, all of the ways to contact us are just literally, you'll find all of our contact details on the University of Galway website.
Okay. Well, thanks very much, everyone. We'll leave it there so for today, and wishing you a really happy Christmas and a very happy New Year as well, and lots of swimming and water sports in the future. Thanks, everyone.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
Mhm.